On today's podcast.
But I was taught the same thing. What's it gonna matter? You already know they have antibodies. It's Hashimoto thyroiditis. It's autoimmune thyroid disease. Doesn't matter. It is what it is. But the antibodies give critical information about what's going on with the immune system. Don't we want to stop the autoimmune assault?
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Hey there, Vibrant Wellness Warriors. I am one of your hosts, Jen Rivas, and with me is the ever insightful Dr. Emmy Brown. And listen, if you've ever wondered about the secrets to achieving that perfect balance in your body or found yourself reminiscing of those days where you were filled with boundless energy, or perhaps it's your specialty within your practice, then you want to listen up because we are diving deep into the world of endocrinology, hormones, thyroid, and the magic of individualized care. Our guest today is not just any expert. She is leading the charge in her field. Dr. Angela Meza is renowned for her tailored approach to patient care, ensuring that each individual achieves their unique health goals. So it's her belief that as we age, our hormonal changes play a pivotal role in our overall health, longevity, and quality of life. And she is on a mission, a passionate one, to help each of us find that sweet spot of metabolic and hormonal balance. And if that wasn't enough, she is also, or I should say she has, graced us with a book, Thyroid Talk, an integrative guide to optimal thyroid health, which I'm sure we're going to dive into a little bit. So if you are ready to unlock the secrets to vibrant health and rejuvenate your health journey, I would love to welcome Dr. Angela Meza. Oh my goodness, say it again for me. Meza. Thank you for being here.
Oh, thank you so much for having me. That sounds like lofty goals for a podcast.
Well, we always have fun. And I think that, the intro it's always great. So I'm going to kick it off though, Dr. Meza. I'm sure over the course of your career, you've observed an increasing prevalence of thyroid conditions. And before we jump into kind of the nitty gritty and why that might be occurring, I'm wondering what really led you to go from more traditional medicine, more conventional medicine, and start to look at more nuanced issues within thyroid conditions.
Right. So I am an osteopathic by trade. I always went into osteopathic medicine because it was a whole body approach to wellness. But I did do the traditional route as far as internal medicine and endocrinology. So when I entered the real world, I joined a hospital-based practice and started working in the real world. I was taking care of patients with diabetes, thyroid issues, and hormone-related issues. And what I found was my patients weren't getting better, even though their labs weren't getting better. So their thyroid levels were technically within the normal range, but they didn't feel well. I felt like we were missing a lot of cases too. So we were mistreating according to guidelines and missing potential opportunities for patient care. So that's when I came upon integrative medicine. It kind of changed my life. So I left the traditional kind of world where traditional medicine doesn't really treat the problem. It fixes it. It's like someone with diabetes, just giving them a diabetes medicine and not addressing diet and meal planning and exercise. Mixed with functional medicine, which has a more root-based cause. So integrative medicine combines both traditional as well as functional medicine. And I really felt like that was the key to optimal thyroid care. So that's when we founded Metabolic Center for Wellness, which is my practice here in Central Florida. So we care for patients on a daily basis with all types of hormone issues. But my passion is thyroid disease. So both hyperthyroidism, hypothyroidism, autoimmune thyroid disease, which is on the rise, thyroid nodules, thyroid cancers. So that's kind of our passion and our goal here at Metabolic Center Wellness.
Awesome. Can you shed some light for us on the impact of environmental factors, lifestyle choices, and genetics in the rise of these thyroid disorders?
Sure. So genetics, we can't really play too much with them. But if you think about way thyroid hormone is made, it's made by a series of complicated steps. So we got to take up iodine into the thyroid, oxidize iodine into iodine, And these series of steps, even we have to convert T4 to T3, which is the active thyroid hormone. The thyroid hormone actually has to get to the nuclear receptor, cause, activate, or repress different transcription. So anywhere along that way, that's a gene. So you can have genes that affect any of those things, but we can't control the genes. But environmental factors, we're surrounded by them every day. So an environment can affect any step along that way of thyroid hormone production too. So environment plays a huge role. So we're exposed to chemicals all the time, thyroid disruptors, you call them. And then there's lifestyle, our sleep, our stress levels, what we eat. I mean, it's all tied together.
Yeah.
But it really all comes down to, we can't control genes, but we can control things like inflammation. So lifestyle and environment affect inflammation. So if we can keep inflammation low, the thyroid's happier. The thyroid's so sensitive to inflammation.
Mm-hmm. I'm curious, Dr. Maza, could you share maybe like 2 or 3 things that you do on a daily basis that kind of keeps those things in check? I always love to hear practical tips from people that are in the trenches doing this.
Oh, yeah. So the only things you can do is a daily detox. So you don't have to do a fancy detox, like 10-day, 28-day, real complicated fasting or anything like that. But if you sweat on a daily basis, that's a good daily detox. The thyroid loves selenium. Selenium is key. I call it the thyroid micronutrient superstar because selenium is key to only protecting the thyroid, but helping the thyroid work its best and optimize its performance. So just a couple of Brazil nuts a day is enough selenium that you would need. You can take a supplement, like just a couple Brazil nuts.
I'm just imagining the Brazil nuts on your desk right now, Dr.
I
Maza.
know.
Just like a pretty little glass jar, with the seat next to you for everyone to share. That's what I would do.
Perfect.
Totally.
Now, I know you mentioned you've established the Metabolic Center for Wellness in Florida. So we like to ask to providers this a lot of times is explain to us your intake process form, because we know that it can be so different than the conventional route. Like, what do you feel like is sort of unique in your process, and maybe explain sort of your philosophy and what you're trying to capture during that intake process?
So when I'm meeting a new patient, I don't just do the traditional, like, are you gaining weight, losing weight, having chest pains, palpitations. I really like to dig deep into what your everyday life is, because I have to know what your everyday life is, because that's not only affecting, because that's what's getting you where you're at right now, right? And what's going to be things that we can change a little bit? What are things that are fixable things, or if we have to change them? So work schedule, that's key. Shift workers, if you're a shift worker, you may not be able to change your shift. It's got to be practical things. So that all ties together with not only coming up with a game plan, lab interpretation, what's going to be a feasible kind of medication plan if we have to add medicines. So it's all kind of tied together, because that's the key of personalized medicine. It's not just a checklist, but it's really what is the world that person lives in.
Mm-hmm. How long do you usually take with a patient, just out of curiosity? Is it 60 minutes? Is it 90? I know some can be very, long and arduous.
Oh, yeah. Ours is usually about 45 minutes to an hour.
Okay, great.
Pretty reasonable, typical. Okay, Dr. Maza, I have to get into labs. I want to get into labs, particularly with this topic. So keep it really simple first. What makes up your thyroid panel? I'm sure we're individualizing here and there, but if someone's coming in, you're suspecting hypothyroid, what makes up your ideal thyroid panel? And then any optimal ranges for TSH and free T4 and others, if applicable.
Yeah. So if we're looking at my go-to thyroid panel, it's going to be a TSH. Goals going to vary based upon what circulating T4 and T3 are. So goal would be right around 1 to 2. Again, like you said, it's going to vary based upon the person. Free T4 is my next one. So that's going to be usually around 1 to 1.5. Free T3 we shoot for a mid 3 to upper 3, even 4 range. Reverse T3. So reverse T3 is the inactive form of T3. Reverse T3 gives a ton of information. It not only gives information about mitochondrial health, overall wellness and nutrition, but it also says, hey, if they're on T4, are they getting too much T4? So we want reverse T3 to be at least less than 12. Always check thyroid antibody. So that's the anti-thyroid peroxidase antibody and the thyroglobulin antibody. There's kind of some debate on that. Should there, even if there is a range, like Quest and LabCorp do have a range of less than, each one has a less than range. Should we have any thyroid antibodies? Well, it's always something good to follow, especially when you're already treating someone for Hashimoto thyroiditis. So you want to follow those antibodies to say, hey, is what we're doing actually fixing things? We really want to get that autoimmune assault under control. I always check for iodine. Iodine's kind of my sticking point because so many supplements out there have iodine in them. And too much iodine isn't good. It can actually cause a problem, especially in patients with undiagnosed autoimmune thyroid disease. Yeah, not enough iodine isn't good either because it's a building block of thyroid hormone. So there's not great tests. I mean, micronutrient testing always helps out because I love micronutrient testing.
Sure.
It's like everything all at once. What do I need to pick? If you don't have that luxury, you can get a random urinary iodine with a random urinary creatinine and pretty much extrapolate out what a 24-hour urine would be. You really want that to be between 100 and 250 micrograms per liter. But those are my go-to, I think, for the thyroid levels. But then there's micronutrients too. So those are key in thyroid hormone functioning. So things like iron. Iron's part of thyroid peroxidase. That's the enzyme that makes thyroid hormone. So if you don't have enough iodine, you're not going to have good functioning of thyroid hormone enzyme working. Magnesium's important. There's so many, like selenium's important. So the micronutrients are key to thyroid health because sometimes if you're low in micronutrients, if you replace those micronutrients, the thyroid's able to work better. It's got what it needs to work.
Right. Those tools are so important. And especially foundationally speaking before medication, if maybe you're on the fence. So good reminder there.
I put someone on medicine if they don't need to be on medicine. That actually needs to water a little bit.
Right. And you touched on this, Dr. Mazza, in terms of the thyroid antibodies being repeated. So I was trained, once you have established autoimmune thyroiditis, no need to repeat them because they don't correlate necessarily with the clinical presentation. But I would love to know your experience because it sounds like you do repeat them and you feel there's value there.
Oh, there's tremendous value. But I was taught the same thing. What's it gonna matter? You already know they have antibodies. It's Hashimoto thyroiditis. It's autoimmune thyroid disease. Doesn't matter. It is what it is. But the antibodies give critical information about what's going on with the immune system. Don't we want to stop the autoimmune assault? I mean, if we can preserve thyroid function, because essentially that autoimmune disease is eating away at the thyroid. What's so interesting, and I wish I could show you, is I do ultrasounds on a regular basis. You can actually see the changes under ultrasound in someone with Hashimoto thyroiditis. You can see where there's still good tissue there, but you can see where it's all fibrotic. But if you can prevent from getting to that fibrotic stage, that the antibodies kind of lead the way. Plus, the antibodies will tell you, is there something going on otherwise? Are there other infections going on? Is the medicine that you're using, if you are using medicine to treat Hashimoto thyroiditis, worsening things? And selenium comes back again because selenium is key in bringing down thyroid antibodies. We have so many studies that show the benefits on thyroid antibodies with selenium. So I agree. I was trained the same exact way.
Right. And if you even measure it, conventionally, they're not really even measured. If we have established hypothyroid, it's just assumed Hashimoto's, they're never even looked at in so many cases.
Right.
Which is wild.
There's lots of value to them. Plus, if you think about it, I mean, Hashimoto thyroiditis is one of the most common autoimmune conditions. If you can prevent the progression of Hashimoto thyroiditis, you can think, hey, maybe we can prevent the emergence of other autoimmune conditions. So it's very important.
Absolutely.
So let's talk about why gut health is so critical to maintaining thyroid health, right? You've mentioned micronutrients, but I also know you have other few tests in your arsenal that you like to use. So can you kind of walk us through that and how you use that to assess and manage thyroid disorders?
Sure. The gut is critical. So you might have heard of the autoimmune triangle. So the autoimmune triangle is really at one point is genetics, which we already talked about. We can't change genetics. The second is really inflammatory environmental things. So
Mhm.
infections we've come across over time, toxins, stress, those things. And lots of times you can't control them because we're after the fact there. They're in the history already. But then there's the gut. So the gut's really that third part of that autoimmune triangle. So the gut is so important because it's really that semi-permeable barrier from what we take from the outside environment to our internal environment. And when that barrier gets compromised, we're letting things into our system that shouldn't be there. So like undigested food, toxins, pathogens. And once that enters our system, it causes the immune system to start misrecognizing things. In the case of autoimmune thyroid disease, it's thyroid. So gut testing, I feel, is really, really important. Some people will say, well, why do you check for leaky gut? Most people have leaky gut. Patients with autoimmune disease have leaky gut. But I think it's valuable because it tells you, yes, if it's present. 2, to what extent is the issue.
Mm.
3, it helps guide your kind of healing gut pathway. And 4, it shows your patient what's going on. Here it is. You actually have gut issues. So
Yeah.
that's why you have to avoid inflammatory foods. That's why we have to get you on a good probiotic. That's why we have to kind of go through the protocol to heal your gut. So gut testing is critical, especially in Hashimoto's thyroiditis.
Yeah, we touch on that a lot, don't we, Dr. Emmy, about like sometimes when you have the facts in front of your patients, that those scientific data doesn't lie. So now they're faced with, okay, there's an issue. What do we have to do to
Yeah.
fix it?
The objective
Yeah.
information is hard to argue with, so it can be very motivating for everybody. Even myself, I've been very stubborn, and then you have it on paper,
It is what it
Exactly.
is,
There's no
right?
bias. There's no, twisting it one way or the other. It's just very clear, black and white. So yeah, I agree. That's a huge value there. What about the wheat zoomer? Just in general, if you don't order the wheat zoomer, what about gluten? I mean, many practitioners know that there's this molecular mimicry between gluten possibly and the thyroid gland, and then you get the antibodies involved. What's your take on assessing for gluten sensitivity? And overall, that whole idea in terms of gluten consumption for folks who are struggling with thyroid issues.
Right. So for all of my patients with autoimmune thyroid disease, I do often our first visit, I need you to stop inflammatory foods. That's going to be gluten, pasteurized dairy, at least those 2 things. And they're like, well, I'm not gluten sensitive. And then, okay, just do me a favor.
try
Just give me a
it.
few weeks. Let's try it. See how you feel. I mean, if I'm wrong, I'm wrong. But But the wheat zoomer does add a lot of valuable information. I do order on a regular basis. One, it has an intestinal permeability panel in it, so the checks for zonulin, lipopolysaccharide, and actin, which help guide me at what level of leaky gut we're dealing with. Plus, lab tests for celiac they're just bad. Even the gold standard for celiac, which is a biopsy, is bad. But what I like about this test, it's going to check for all parts of the wheat itself. So we're not just checking for gluten in general. It's really in all the parts of the wheat. So, I mean, before I started ordering this, I didn't realize how many different parts of wheat there were. I'm like, oh my God. And if you have sensitivity to any of those parts, every time you're taking in gluten, you're making the situation worse at the level of the gut. I mean, if you don't already have issues with inflammation at the gut, say you take in gluten, you're going to have some temporary inflammation, but then it's going to, your epithelium is going to kind of heal itself. If you have this ongoing, you're just constantly putting fuel on the fire, we're never going to stop the autoimmune assault.
Mm-hmm. So
and then you're speaking in general in terms of inflammatory foods, Dr. Mazza. So I agree with that. You think about dairy and wheat and gluten at the top of the list. But in terms of that molecular mimicry with the thyroid, do you find that there is something there? I mean, I haven't looked at the literature specifically, but I'm curious what you think about that relationship.
Well, molecular mimicry, that's kind of the root driving cause of autoimmune thyroid disease. So, and if you're following thyroid antibodies, if you do kind of stop that misrecognition, you're going to see a decrease in those antibodies.
Mm.
I see
And
it
that's
every
got to be
time.
convincing for people who don't want to pull out the dairy or the gluten, but they
Oh,
see that and, obviously, and if they're feeling better, all of that paired together.
and it's so funny. Like my patients will come in and be like, "Okay, what are my antibodies?"
And you're like, have you cut out gluten?
Yeah. Because we'll have people that come in, their antibodies are so high we can't even measure them. But with time, it takes time because these antibodies took years to get to that point. So it's just like, just
Yeah.
stay with me. Keep
Yeah.
cutting it out. It's working, believe me. So
We all want that immediate, response,
yeah.
right? The quick fix. Man, we're gluttons
There's
for
no
Well,
that.
and
magic
I'm
pill.
curious,
I
and again,
know.
of
There
course,
really is.
so much individual variation, but generally speaking, what timeline are you seeing? I'm really curious. Are you seeing antibody decreasing, after a month, 2 months, 3 months of taking out inflammatory foods, or how long?
Well, we're looking for any improvement. I mean, it can at least be 3 to 6 months to see any movement because there's going to be a little bit of up and down. We're catching it at a certain point in time in the beginning. So um, recently, I had one woman. Her antibodies were so high, she's celebrating because now her antibodies are down
Wow.
to 200 versus
Wow,
more
that's
than
awesome.
900. So, and that's taken years.
It's all
That's
relative.
taken years, but it's all relative. But any improvement's good improvement. So usually between 3 to 6 months, we'll see
Right.
some
And that's
movement.
pretty typical for antibodies to move. It takes at least several months. Um, okay, so that's very helpful in terms of thyroid. And of course, a lot of people are struggling with hypothyroid, but for thyroid nodules, I know that you're a pioneer in this area. So radiofrequency ablation. Can you talk to us about what is RFA and why have you chosen to really pioneer this non-surgical method?
Sure. Well, thyroid nodules are extremely common. If we ultrasound everyone that walks down the street, 1 in 3 persons, one time at some time in their life, rather, will show up with something under the ultrasound. And most nodules aren't a problem. Most nodules, they come and go, but some grow. I mean, some are cancerous. Those are the ones we don't want to miss. But some grow and become a problem. Some are overactive. Now, up until the advent of radiofrequency ablation, the only treatment option was usually surgery. So to take someone's thyroid out, or at least part of their thyroid out. So even when you take out half of a thyroid, there's a 25% chance of not only requiring thyroid hormone replacement, there's also a chance of surgical complications like affecting the parathyroid gland, the nerve that goes to the voice box. So radiofrequency ablation is a non-surgical treatment for thyroid nodules. So basically, radiofrequency ablation has been used for years for all sorts of tissues, like soft tissue, lung, actually liver tumors or kidney tumors. In cardiac medicine, it's been used. But back in 2002, it was initially started for benign thyroid nodules in Korea and toxic nodules, which are overactive nodules. But not until the end of 2018, 2019 was it FDA approved for use here in the United States. So we kind of tripped. Everybody else in the world was using it. It's not
So
us.
far
Wow,
behind.
I didn't realize. I mean, took a long time.
Yeah.
Yeah.
So, I mean, for years I've taken care of patients who had their thyroids taken out that didn't necessarily have
So
to have it
frustrating.
taken out. And the thyroid essentially affects every system of our body. You can't say one thing that the thyroid does not affect. So, then you're left with essentially replacing what a gland was working and doing for itself with the medicine. And it's not a quick fix for everybody. So that's what's so great about radiofrequency ablation. We do it here in the office. We use it under ultrasound guidance, and it's really targeted treatment for thyroid nodules. So, we see improvement over time. Most folks, depending upon the nodule, and we've had some really large nodules too. I mean, anywhere from 10 milliliters up to like 175 milliliter nodules. I mean, these are very large nodules. And depending upon the nodule, kind of determines the amount of sessions that are required. But patients are happy. They have their thyroid function. They didn't have to have surgery. They didn't have to take off time from work. They don't have a scar. I mean, it's really kind of a game changer when it comes to treatment of thyroid
Amazing.
nodules. And thyroid, and it was actually approved for even small thyroid cancer. So the micropapillary cancers that are about 1.5 centimeters or less, where up until this point in time, it was either take your thyroid out again or just watch. So you're left with that cancer, and patients get very upset about that. They know they have cancer. So we're just going to do an ultrasound every 6 months to a year. And that causes a lot of anxiety. And then those people actually, when we look at data, actually end up having their thyroid taken out because they're so anxious.
I was thinking about that, just the trickle effect of that and the effect on your psyche, your emotions, like everything. Yeah. Wow.
So RFA's become a big deal, and I'm so happy. We're the only clinic here in Central Florida doing it, and I'm only integrative endocrinologist doing it. So I mean,
That's
we're so happy to be able to give this service. We have people coming from all over the country, from Canada.
Wonderful.
So
it makes sense for an integrative endocrinologist, which is so hard to come by on its own. And now you're offering this, the RFA. And I'm curious, excuse my ignorance, but is it completely non-invasive? I mean, so there's no needle, is it just completely superficial with the RFA?
Yeah, no, it actually is kind of like a thyroid nodule biopsy. So there's a needle that's involved, but the needle's a little electrode. So it kind of goes to each part of the nodule, and I can systematically ablate. We see real time changes. It's pretty cool. So there's immediate ablation. We don't see the full effect because there's some ongoing conductive ablation until 6 months to a year. So that's when we see the full result of the nodule. We just had a follow-up, 3-month follow-up today here in the office. She was super happy. By 3 months, she's had 80% reduction of her nodule. And she started out with a 30 milliliter nodule, which is kind of, you think about having 30 milliliter mass in your neck. Yeah. So these are we're having real great success stories.
That's amazing. I was going to ask, because I know you said it varies obviously on the size, but as far as your treatments, Dr. Mazza, how far in between are they? How long is each treatment?
Yeah.
On average?
So if we have to do another treatment, we usually wait at least 6 months to a year.
Okay. So sometimes one and done, you're saying. Otherwise, it's follow-up treatments? Okay.
Yeah. Sometimes the overactive nodules, especially if they're larger, they're very vascular. So we have to get all that vascularity. It's tough to do safely in one session. So oftentimes we have to do another one. And with the really large nodules, sometimes people are like, even just one session, I'm okay with just having less neck compression, or I'm swallowing better. So I'm good with just one.
They already get some improvement. Yeah.
So
very cool.
Yeah, it's pretty cool. It's kind of really
especially when you
gratifying.
can see it in real time, like you said.
Yeah.
Cool. All right, well, I'd love to talk about your book, The Thyroid Talk, an integrative guide to optimal thyroid health. It's garnered a lot of attention, Dr. Mazza, and I'd love to know if you can share some insights in the book and explain its significance to both practitioners and patients.
Sure. Yes. Thank you for asking. So we got to a point where we weren't taking any new patients except for RFA and thyroid nodule biopsies, and we have patients calling every day. So I feel so bad because there's people suffering from thyroid issues. And I wanted to come up with a way to, how can I help them with their health? How can I help them have conversations with their doctors about their health? So that's kind of became the basis for the podcast that I have, Thyroid Talk with Dr. Angela Mazza, as well as the book. So how can I help motivated patients? So these are the focus of the book. How can I help motivated patients? Because like I mentioned before, there's no magic pill. There's lots of magic pills, but there's not one individual. And how can I help providers who don't feel comfortable with integrated medicine? They don't know about thyroid antibodies. How can I help them learn more? And how can I improve the dialogue between the patient and the doctor? So that's what it came down to. I wanted to provide research-driven information that is going to help someone for the long run, improve not only the thyroid, but their overall health.
Can you share, and thank you, by the way, because I'm sure it's helped so many, but what would be maybe just a few sort of critical takeaways that you're hoping readers gain, or providers alike from your book?
Right. So one of the things I talk about a lot in my book is, would you mention micronutrients quite a bit. We talk about healing the gut. We talk about stress management and cortisol's effect on thyroid, which I don't think a lot of providers really. I don't think that they don't think about it, but I think they don't understand the relation between cortisol and thyroid. Um, we talk about vitamin D a lot because of the impact of vitamin D on autoimmune thyroid disease. But we really talk about a lot of autoimmune thyroid disease, Hashimoto thyroiditis, Graves' disease. And then actually the book is going to be followed up with a master class that digs even deeper because it's a lot of information for a book. I don't think everybody's going to get all the information, even reading it twice. Some people are going to want more information and it's even providers so that they can have a conversation with their patient. Because I know even my patients, even though they know me, they share a lot. I don't think they share everything. So I think you have to be able to pull out, know what to ask. And I think that's a skill that sometimes us as physicians, with the constraints of time, everything else going on, we don't always have that skill set.
Absolutely.
Yeah.
Okay, so you mentioned a master class. Is it, Dr. Mazza? Is that for practitioners only,
Yes.
or is it geared towards patients?
It's for patients, and practitioners are kind of like getting involved in integrative medicine. It's a great introduction to integrative medicine for physicians because you got to start someplace. You're not going to start at gut testing right out the gate. You're not going to start focusing on mitochondrial health right out the gate. You're going to start with things like probiotics and how to read a cortisol curve. When do you order a cortisol curve? When do you think about adding nutraceuticals in with your Hashimoto patients? What nutraceuticals do you add? It's integrated medicine is a learning curve, and you have to start someplace. So I was at the A4M conference not too long ago, symposium, and they said, show of hands, how many people here are new to A4M and bioidentical hormones? And it was like 80% of the audience.
Wow.
So, I mean, physicians are looking into it. They want to learn more. They want to be able to have intelligent conversations with the patient because patients are looking into it and they're doing their research.
Yeah, it's catching on. It's kind of it's funny because I have my primary care kind of conventional doc, and of course on my list to do is to find a functional medicine doc who can also serve as a primary care, but there's difficulty in that. And I'm wondering, especially the younger providers, I'm thinking, how can they not be aware of functional medicine nowadays? But it is so niche still, even though the wellness industry is booming. Sometimes I feel, especially just the younger providers, if they're on Instagram, they're seeing all the social media, if they're interested in health overall and nutrition, it's hard to imagine that they're not. But it's true. So many providers are still unaware that there's this whole world of nutrition and gut health that needs to be addressed, and stress management. So I think that offering of yours is fantastic. And I'd love to know, as we kind of touch on, you said cortisol and thyroid, that link. Can you just give us a little bit of an overview? I think that that's such a fascinating topic because we talk about stress so often.
Oh yeah, cortisol is key because if you miss an adrenal issue and you're just treating thyroid hormone, you actually can make the thyroid. You can make everything
all connected.
Worse. So I mean, doing a 4-point cortisol curve just gives you so much information. I mean, it's going to tell you is this person high all day on cortisol? Have they progressed to the point where their hippocampus is kind of dampening everything, the pituitary is dampening everything, where you have a low cortisol curve? Because that's kind of a tough situation. So if you have someone with hypoadrenalism and you're just focused on adjusting thyroid hormone, say their TSH is a little high, they're tired, they're fatigued, you're like, oh, it must be the thyroid, right? So let's up their thyroid medicine. But what happens is you start metabolizing out whatever cortisol they have, and you make it a lot worse. And there's studies that show that persons with high cortisol is an inflammatory response. The immune system has an overdrive. So we do see changes and increase in autoimmune thyroid disease in those cases. So the cortisol and thyroid go hand in hand. You don't want to miss anything going on with the adrenals.
I'm curious what your stance is too, Dr. Mazza. If within your practice, we talk to a lot of providers that will sometimes refer out or have a team within their practice. I mean, we've touched on micronutrients and diet and lifestyle choices and, mindset, stress. Do you have that sort of resource of people that you can reach out to, or is that something that you kind of you're all encompassing as far as how you treat that patient?
Yes, we're a small practice, so we do refer out for therapists that kind of help out with um, emotional wellness. We have dietitians that we refer to and trust. So those are kind of our go-tos as far as, but everything else we do here in house.
Okay,
Fantastic.
great.
Well, we're wrapping up here, Dr. Mazza, but I wanted to see if there's any other exciting events. You mentioned your workshop. I'd love to get the name of that for our listeners. Any other training opportunities
Sure.
for practitioners or information for patients that you want to share?
Um, well, I mean, we have the podcast, we have Facebook and Instagram, but as far as the masterclass, I can forward the information. That's kind of our big level of focus right now. So, but and then the book is out on Amazon right now, and we're so happy it's the #1 new release. So,
Yeah, and we will make sure that we've got all of those links in our footnotes. But do you have a name for the masterclass or when it's actually going to be launching?
sure, it's Thrive Through Thyroid. We'll be having 3 webinars that are upcoming in November, but we're looking to have modules set and running up for patients as well as providers by January 1.
Fantastic.
All right, Dr. Mazza. Well, it's been such a pleasure. Thank you so much for sharing your insights. And obviously, it's a complex topic, and we don't want to overlook other systems, as we mentioned, micronutrients and gut health and adrenal health. So that's why the training and that masterclass is, I think, so valuable in your book also. So before we say goodbye, we'd love to learn about you more personally and lighten the mood a bit. Would you mind answering our 3 rapid fire questions? Beautiful.
Sure.
Okay. It'll be fun, I promise. I have the first one. What's your favorite?
Interesting. You.
She's like, I'll be the
that's
judge
fine.
of that.
Okay, what's your favorite way to de-stress after a long day at the clinic?
Hanging out with my husband and my dog and my cat and crocheting.
Very quaint.
I love that. I love
Yeah.
that. My 12-year-old just took up crocheting and she taught herself. It's an amazing thing. I love it. Second question. Tell us a memory that brings you immense joy.
Oh, wow. Probably my wedding day. So that was a great day. It went by so fast. My husband and I have been married 21 years now. So our wedding day is probably one of the most special days of my life.
That's great. Where did you get married? Just out of curiosity.
We got married in Delaware. So we got married in Delaware and had a reception in Pennsylvania.
Well,
right
I
outside
got
of
to know
Philly.
the season because we were just talking about the fall earlier. When was it?
Oh my gosh, we picked like the worst season because I was in med school still. So I only had a certain amount of time where we could get married, and it was in February. So we were like, well, let's go for a Valentine's theme. So we got
There
married
you
on
go.
February 16th because that was the closest to Valentine's Day, but it was a weekend. We had a beautiful day. It was unseasonably warm. And that day, a year later, there was a blizzard.
Oh,
I got so
Never know
lucky.
what you're going to get.
yeah. Well, now
Cool.
that's right. Oh,
Okay,
that's great.
last one. If you could offer one piece of advice to your younger self, what would it be?
I would say probably don't be so hard on yourself. Things are going to be okay.
That's always a good one.
Always good advice. All right. Well, again, we cannot thank you enough for being here, Dr. Mazza. It was a pleasure speaking with you today. I know you mentioned your website, Facebook, all these things. Let's make sure our listeners know, even though it's going to be in the show notes. Why don't you tell them where that is and how they can reach you?
The website is metaboliccenterforwellness.com.
Perfect. And is your Facebook, I think you mentioned Facebook or Instagram, is that the same?
Yes.
Okay.
And
Excellent.
then I do have TikTok, although I don't.
Oh, you threw it
Oh,
out there. Now
okay.
I got to look. I love it.
Yeah, now I'm going to go look that up. That's awesome. Well, thank you again for being here. We look forward to hopefully having you back sometime soon. And in the meantime, to our listeners, stay vibrant. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.